Students, today's topic of discussion is mental health and substance abuse disorders. Health is not only the physical health but also includes maintaining harmonious relationships with other living beings and having spiritual direction and purposes. Mental health disorders are common in general population and usually present themselves as worry, tiredness, and sleepless nights and may affect more than half of the adults at some time. Mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to her or his community. Next, I am coming to common mental health problems. The common mental health problems are depressive disorder, number 2 anxiety disorder, number 3 attention deficit hyperactivity disorder, number 4 bipolar and related disorders, next conduct disorders, next obsessive compulsive and related disorder, next schizophrenia, and trauma and stress related disorders. So first of all, I am coming to the depressive disorder, including major depressive disorder. The depressive disorder are the most common mental health disorder that can be found in the community. The person suffering from these remains sad and irritable, feels hopeless and empty, and in some extreme conditions might have physical symptoms like non-specific pains, marked loss of interest or pleasure in anything that significantly interfere with daily life, present nearly every day for a period of at least 2 weeks. The other presenting features may be significant weight loss or gain, inability to sleep or excessive sleep feeling or restlessness, lethargy, feeling of worthlessness or excessive guilt, distractibility, and recurrent thoughts of death, including suicidal thoughts or plans. This type of disorder mainly occur in children and adolescents. Female youth have seen to be about 3 times more likely to be predisposed as against male to experience depressive illness through they might manifest it as irritability rather than a sadness. Next, coming to the anxiety disorder. The daily functioning of the individual suffering from anxiety disorder is disturbed by excessive fear to real or perceived threat that are difficult to control. This disorder can range from specific fears such as the fear of heights, flying, or public speaking to more generalized feelings of worry and tension. Anxiety disorder typically develop in childhood and persistent to adulthood. Next, coming to the attention deficit hyperactivity disorder. So, attention deficit hyperactivity disorder is one of the more common mental disorder diagnosed among children and occurs 4 times as often among boys than girls. A child suffering from attention deficit hyperactivity disorder is less attentive in class and cannot focus on the task given and has difficulty in controlling behavior and is usually hyperactive. These children talk excessively, run about in the class, and find difficulty in sitting still. The genetic predisposition has been observed in cases of attention deficit hyperactivity disorder. Environmental risk factor may include low birth weight, smoking and alcohol use during pregnancy, exposure to lead and history of child maltreatment. Next, coming to the bipolar and related disorders. People suffering from bipolar and related disorder complain of sudden mood swing ranging from period of intense happiness and impulsiveness to extreme sadness and feeling of hopelessness. Behavioral changes like fatigue or loss of energy, sudden significant weight changes, complaining about pain or suicidal thoughts or plans may also be associated. A family history is a strong risk factor for this condition. Next, coming to the conduct disorder. The child suffering from conduct disorder has violent behavior to the extent that it might disrupt the social norms for his age, thus affecting the child or family's daily life. The primary symptoms of conduct disorder include aggression to people and animals, destruction of property, theft, and serious violation of rules. Symptom must be present for 12 months and fall into one of three subtypes depending on the age of onset, that is childhood, adolescent, or unspecified. It most commonly affects children and adolescents, with increase seen as age advance from childhood to adolescence, with male affected more than females. The children having behavioral problem and below average intelligence in infancy have higher predisposition of conduct disorder. The family history of conduct disorder or any other behavioral disorder like ADHD, which I have previously discussed, that is attention deficit hyperactivity disorder, schizophrenia, substance use disorder increases the risk. Next, I am coming to the obsessive, compulsive and related disorder. Patients suffering from obsessive compulsive disorder have unwanted thoughts, urges or images that persist and intrude in daily living, that is obsession, or behavior that he repeats ritualistically in order to control obsession, that is compulsion. Obsession may include persistent thoughts. For example, the person feeling dirty hands, images like horrific senses or urges, for example, to jump from a window, and are perceived as unpleasant and involuntary. The person thus compulsively puts effort to prevent or reduce anxiety or distress that are clearly excessive or unrealistic. A common example of an obsessive-compulsive disorder symptom is a person who obsessively feels his hands are dirty and thus repeatedly washes his hand excessively to clean them. OCD or obsessive-compulsive disorder symptom are time-consuming and cause significant dysfunction in daily life. The obsessive-compulsive disorder includes the presence of obsession, compulsion, or both. The disorder tends to begin usually in childhood or adolescence. The positive family history and child maltreatment or traumatic childhood events act as predisposing factors for the disorder. Next, coming to the schizophrenia. Schizophrenia is a disorder of brain in which the way a person thinks and is characterized by a range of symptoms including the delusion of false and persistent beliefs, hallucinations that include hearing, seeing, smelling or feeling things that other cannot, disorganized speech that involves difficulty organizing thoughts, thought blocking, and making up nonsensical words, grossly disorganized behavior. Next I am coming to trauma and stress related disorder. These disorders usually occur following previous exposure of a traumatic or dangerous event. The most common disorder in this category is post-traumatic stress disorder. The patient can present with symptoms ranging from re-experiencing symptoms from the event, such as flashback or recurring upsetting dreams, upsetting memories, psychological disturbances, avoidance of stimuli associated with the traumatic event, mood changes, changing a personal routine to escape having to be reminded of an event, or getting tense to the extent that makes it difficult for him to complete the daily task. They might have increased reactivity like being excessively vigilant, easy distractibility, irritability, or even self-destructive behavior. This can be seen in people who have gone through various traumatic events like rape, natural disaster, child abuse, car accident, etc. Here I am completing up to the common mental health problems. From my next class, I will continue from substance use disorder. So please follow my next class. Thank you.